Why are surgical drains used after excess skin removal surgery? Imagine your body after removing a large amount of excess skin, like after significant weight loss. Your surgeon needs to help your tissues heal properly, and that's where surgical drains come in. These small tubes are placed during surgery to help manage the fluids your body naturally produces after tissue removal. When excess skin is taken out, especially in procedures like tummy tucks or body lifts, large areas are dissected, creating potential spaces where fluids can collect. These fluids include blood, serous fluid, and lymphatic fluid, all of which can build up in the empty spaces left behind. If these fluids are not drained, they can cause complications like fluid pockets called seromas, blood collections known as hematomas, or even infections. These issues can delay healing and affect the final appearance of your surgical results. The drains are usually soft, thin tubes connected to a small suction bulb. They are inserted through tiny incisions near the surgical site. The suction gently pulls out excess fluid, preventing it from accumulating. This continuous removal helps keep the area clean and dry, which promotes faster healing. It also prevents the pressure that fluid buildup can exert on the healing tissues, reducing the risk of wound separation or distortion of the surgical contours. In procedures like abdominoplasty, lower body lifts, arm lifts, and thigh lifts, where large amounts of tissue are removed, drains are especially important. They help maintain a healthy healing environment by controlling fluid buildup. For smaller procedures, such as some breast surgeries, drains might not always be necessary, but when large tissue removal occurs, they are a helpful tool. Proper drain management is crucial because it also lowers the chance of infection. Stagnant fluid can become a breeding ground for bacteria, so removing it reduces this risk. Surgeons and patients monitor the amount and nature of the fluid collected in the drains. This information helps determine when it is safe to remove the drains, usually when the fluid output decreases to a low, acceptable level. While some recent studies suggest that drains might not always be necessary or that their removal timing can vary, they remain as a standard part of many plastic surgeries involving extensive tissue removal. The goal is to support optimal healing, minimize complications, and improve the final outcome. Patients are typically sent home with drains in place and given instructions on how to care for them during recovery. Always remember, it is essential to follow your surgeon's advice and discuss any concerns during your healing process. Consulting with a qualified plastic surgeon ensures the best personalized care for your specific needs.